The chair now recognizes Mr. Bilirakis for 5 minutes.
Thank you. I appreciate it very much. Thanks, Mr. Chairman. I want to thank the ranking member as well for holding this important hearing to shed light on these two disastrous proposals, these rules by this administration that would threaten access to long-term care services for millions of Americans and seniors in nursing homes, particularly in my state of Florida. Unfortunately, those in my state know this all too well, as this is yet another attempt by the administration to federalize the Medicaid program to a one-size-fits-all to the detriment of patients. And again, we think outside the box, and it's working really well, that flexibility in the state of Florida. Thankfully, Republicans on this committee are committed to holding CMS accountable for their Medicaid access rule, which would have damaging impacts on home and community-based services, as has been pointed out all afternoon. It's been pointed out. And leadership in Florida has also led the way in this effort. Our state agency for the Healthcare Administration Secretary, Jason Wyda, sent comments regarding the proposed 80-20 rule to CMS, stating that it would be unduly burdensome, especially considering that Florida statutorily requires HCBS providers to pay their direct care workers $15 an hour. And ultimately, that's the minimum wage in Florida, $15 an hour. And ultimately, the rule circumvents the legislative process and prohibits states from administering their Medicaid programs, which is their lawful right and duty, in my opinion. So first question is for Ms. Killingsworth, and forgive my voice. As you know, we already have workforce challenges and significant shortages among the LTSS staff nationwide. Even if these regulations were to work and resolve the shortages, which we both know they will only make the problem worse, in my opinion at least, we would still be experiencing shortages in the short term regardless. So can you tell us what can states and health plans do now to help support patients when there's a shortage of workers, and there is in home and community-based settings? So I know this is a real issue, particularly in my state of Florida, where we have a lot of seniors. So if you could answer that question, I'd appreciate it.
Thank you, Congressman, for the question. It's a really important question because one thing that we saw during COVID was lots of people who struggled to have access to the care that they needed. And one of the things that we learned during COVID is that there are alternative ways, oftentimes, of providing supports to people in order to meet those needs. Earlier, it was mentioned that one of the primary reasons people go into nursing homes is because of medication administration, and yet across the market, there are an array of very simple to incredibly complex medication management systems that allow people who have issues with medication to be able to manage those medications safely at home. And that could well mean the difference between whether someone is able to stay at home safely or go into a nursing home. That's just one example of a continuum of assistive devices that are now available to people that weren't available a couple of decades ago, that will never fully replace the need for in-person assistance, but oftentimes can give people back tremendous levels of independence in their lives, and then really be able to target that workforce much more efficiently.
It's a good example. I appreciate it. I know there are many examples when you think outside the box, like Florida does. So, Ms. Killow, do you agree with what Ms. Killingsworth said, and can you elaborate on these thoughts? Beyond getting rid of this harmful 80-20 requirement, what are things that we can do instead to help support the HCBS workforce now rather than worsen things? And again, if we put our heads together, we can come up with creative ways. I know there's a path there. So if you could answer that question, do you agree with Mrs. Kellogg?
Yes, I absolutely agree with her. And I do think we have to think outside the box. Again, during the pandemic, it forced us to think outside the box, and we were able to do a lot of things with some additional allowances from CMS at that time. I also believe recognizing legally responsible individuals to work, family members to help work for this workforce. They were excluded and unable to work unless, except for during the pandemic. I know we're requesting that in our state waiver. But allowing those individuals to be paid and worked in the home will help assist this shortage also.
Absolutely, and, you know, it'll save money in the long run as well. So we appreciate, but again, increasing the loved one's quality of life, so very important. Thank you. I yield back.